The evening shift at Central Hospital was winding down, with the usual buzz of activity starting to settle. Dr. Lee Richardson had been on his feet for nearly 12 hours, his white coat showing the subtle signs of a busy day. A coffee stain here, a wrinkled sleeve there. He treated everything from broken bones to severe migraines and was looking forward to heading home to his family. The emergency room doors had just closed behind a discharged patient when they burst open again. This time, the scene was different, far more urgent. 2 paramedics rushed in, pushing a stretcher with a middle-aged woman lying unconscious, her face and neck visibly swollen. Behind them, a young woman in her 20s ran alongside, clutching her mother's purse and trying to keep up while fighting back tears. "What do we have?" Dr. Richardson called out, already moving toward the incoming stretcher, his tired muscles forgotten as adrenaline kicked in. Female patient, around mid-40s, severe allergic reaction, one paramedic reported breathlessly. Restaurant called it in. Possible shellfish exposure. BP dropping, airways compromising fast. The woman's skin had taken on a dangerous bluish tint, and the wheezing sounds coming from her throat told Dr. Richardson everything he needed to know. This wasn't just any allergic reaction. This was anaphylactic shock, one of the most severe cases he'd seen in years. "Get her into Bay 3, he ordered, his voice carrying across the ER with the authority of someone who'd handled countless emergencies. The nursing team moved like a well-oiled machine, each person knowing their role without needing instruction. "Has she received epinephrine?" Dr. Richardson asked, quickly checking the patient's vital signs. 2 doses in the ambulance, the paramedic confirmed. No improvement. The patient's daughter hovered nearby, hands clasped together so tight her knuckles had gone white. "Please," she whispered, "please help my mom." She didn't know there was shrimp in the sauce. Dr. Richardson glanced at the monitors. The numbers weren't good. The woman's blood pressure was plummeting, and her oxygen levels were dangerously low. Her throat had swollen so much that traditional intubation would be impossible. "I need the emergency trach kit," he announced, knowing they had precious few minutes to act. The nurses exchanged quick looks. They knew as well as he did that this was a last resort procedure, but they also trusted his judgment. As a nurse prepped the patient's neck, Dr. Richardson spoke calmly to the daughter. "We need to create an emergency airway for your mother to breathe. I've done this procedure many times before. Can I have your consent?" The daughter nodded frantically, tears now flowing freely. "Yes, yes, whatever you need to do. Just save her." The next few minutes were intense but focused. Dr. Richardson's hands moved with precision born from years of experience. Despite the pressure of knowing a life hung in the balance, his movements were steady and sure. He made the careful incision, inserted the tube, and within moments, the patient's oxygen levels began to rise. The entire ER seemed to exhale collectively as the monitors showed improving vital signs. The immediate danger had passed, but Dr. Richardson knew the next few hours would be critical. As he stepped back to allow the nurses to secure the breathing tube and set up the IV medications, he noticed the daughter had sunk into a chair, relief written across her face. He approached her, pulling up another chair to sit at eye level. "Your mother is stable now," he explained gently. "We'll need to keep her sedated for a while to let the swelling go down, but she's going to be okay." "Thank you," she braved, wiping her eyes. "I don't know what I would have. When she collapsed at the restaurant, I thought," she couldn't finish the sentence. "You did everything right," Dr. Richardson assured her. "Getting help quickly made all the difference. Now, I know this is a lot to process, but I need to ask you a few questions about your mother's medical history." As he gathered the necessary information, Dr. Richardson had no way of knowing that this routine emergency would soon become one of the most challenging situations of his career. For now, he was simply a doctor who had saved a life, something he'd done countless times before. But when his patient would wake up the next morning, everything would change. The next hour in the emergency room felt like walking on a tightrope. Dr. Richardson stood at his patient's bedside, his eyes darting between the monitors and her increasingly distressed breathing. The emergency tracheotomy had bought them time, but her condition was still precarious. Sweat beaded on his forehead as he considered his next moves carefully. One wrong decision could have devastating consequences. "Her oxygen levels are dropping again," called out Nurse Chen, her voice tight with concern. "Down to 89%. Dr. Richardson leaned in, listening to his patient's chest with his stethoscope. The whistling sound he heard confirmed his fears. The swelling wasn't just in her throat anymore. "We need to act fast," he said, straightening up. "Her bronchi are starting to constrict. Get me a higher dose of corticosteroids and prepare another round of epinephrine." In the hallway, the patient's daughter paced back and forth, her phone pressed to her ear as she tried to reach other family members. Through the glass walls of the treatment room, she could see the medical team working intensely around her mother. Each time an alarm beeped, she'd stop mid-step, her whole body tensing. Dr. Richardson stepped out briefly to update her. "The allergic reaction is more severe than we initially thought," he explained, his voice gentle but direct. "Your mother's airways are still trying to close up, even below where we placed the breathing tube. We're giving her stronger medications to fight this." "I don't understand," the daughter said, her voice shaking. "She's eaten at that restaurant before. We had no idea." "Sometimes allergic reactions can become more severe over time," Dr. Richardson explained. "What caused mild discomfort before can suddenly trigger a life-threatening response." "Did you manage to reach any family members?" "My brother's driving in from out of state. He'll be here in a few hours." She hugged herself, looking smaller somehow. "Our dad passed away 2 years ago. It's just us now." A sharp beeping from the room interrupted their conversation. Dr. Richardson rushed back in, finding his patient's blood pressure had dropped dangerously low. The next 20 minutes became a blur of rapid-fire decisions and precise actions. He called out orders as his team worked to stabilize her, each person moving with practiced efficiency. "Push 0.5 milligrams epinephrine. Blood pressure still dropping. Start another IV line. Get the crash cart in here, just in case." The daughter watched from the doorway, her hands pressed against her mouth, as Dr. Richardson made a series of quick but crucial decisions. Each choice could mean the difference between life and death. He'd done this countless times before, but the weight of responsibility never got lighter. Finally, after what felt like hours, but was really just minutes, the monitors showed improvement. The patient's blood pressure stabilized, her oxygen levels crept back up, and the medication began to take effect on the swelling. Dr. Richardson stepped back, allowing himself to breathe deeply for the first time in what felt like forever. He looked at his watch. Barely an hour had passed since the patient had first come through those emergency room doors, but it felt like days. "She's stabilizing," he announced to both his team and the daughter. "The medications are finally working. We'll keep her sedated for now to let her body recover, but I think we're past the worst of it." The daughter's legs gave out, and a nearby nurse quickly helped her into a chair. "Thank you," she whispered, wiping tears from her face. "Thank you so much." Dr. Richardson pulled up another chair beside her. Despite his exhaustion, he knew this moment was crucial when families needed not just medical expertise, but human connection. "Your mother is a fighter," he said warmly. "But she'll need to be careful from now on. Once she recovers, we'll need to do extensive allergy testing and get her set up with an emergency epinephrine pen. This can't happen again." As they discussed the next steps, Dr. Richardson noticed the daughter kept glancing at her mother's unconscious form, her expression troubled by more than just medical concerns. He'd seen that look before, family members wrestling with unspoken complications that went beyond the current crisis. "Is there something else worrying you?" he asked gently. "Anything I should know about your mother's care?" The daughter opened her mouth, then closed it again, seeming to struggle with something. Finally, she spoke, her voice barely above a whisper. "It's just, when my mom wakes up," she couldn't seem to finish the sentence. "Whatever it is, we'll handle it," Dr. Richardson assured her, though he couldn't shake the feeling that tomorrow would bring challenges that had nothing to do with medical care. As he finally left the emergency room that night, hours past his scheduled shift end, Dr. Richardson felt the familiar mix of exhaustion and satisfaction that came with saving a life. Little did he know, this case was far from over, and the real test of his professional dedication was yet to come. Morning light streamed through the hospital window as Dr. Richardson made his early rounds. He'd managed a few hours of sleep before returning to check on his critical patients, with the woman from last night's emergency at the top of his list. The overnight staff had reported her vitals remained stable, and they'd begun reducing her sedation. She would likely wake up soon. As he approached the room, he saw her daughter asleep in an uncomfortable-looking position on the visitor's chair, still wearing the same clothes from the night before. Her brother had arrived sometime during the night and was quietly scrolling through his phone by the window. "Good morning," Dr. Richardson said softly, not wanting to startle anyone. The brother looked up, offering a tired smile and a nod. The daughter stirred, blinking away her exhaustion. "How is she doing?" the brother asked, moving closer to the bed. Dr. Richardson checked the monitors and examined the tracheostomy site. "Everything looks good. The swelling has gone down significantly, and her breathing is much stronger. We'll probably be able to remove the breathing tube in the next day or two." A small movement from the bed caught their attention. The patient's fingers twitched, and her eyelids began to flutter. Dr. Richardson moved to her side, ready to assess her consciousness level. "Mrs. Wilson," he said clearly, "can you hear me? You're in the hospital. You're safe." Her eyes opened slowly, confusion evident as she tried to focus on her surroundings. This was a normal part of waking up from sedation, and Dr. Richardson had done this hundreds of times before. He watched as awareness gradually returned to her face. Then everything changed. Her eyes widened as they fixed on him, and her heart monitor began beeping faster. She tried to speak, but the tracheostomy tube prevented it. Instead, she raised her hands, making pushing motions toward him. Her face contorted with an emotion that wasn't just confusion or fear, it was anger. Mom, it's okay," her daughter said quickly, moving to the bedside. "This is Dr. Richardson. He saved your life last night." Mrs. Wilson shook her head vigorously, her hands still pushing at the air. She reached for the whiteboard and marker that the nurses had left for her to communicate, her hands shaking as she scrawled, "Different doctor." Dr. Richardson maintained his professional composure, though he felt a familiar heaviness settle in his chest. He'd seen this before, it never got easier, but he'd learned to handle it with dignity. "Mrs. Wilson," he said calmly, "I understand you're disoriented. You had a severe allergic reaction last night. You stopped breathing, and I had to perform an emergency procedure to save your life. I know this is a lot to process, but—" She scribbled furiously on the board again, "White doctor." The room fell silent. The daughter's face flushed red with shame, while the brother stood frozen, his expression a mix of embarrassment and anger. Dr. Richardson took a slow, steady breath. "Mom," the daughter finally exploded, her voice cracking. "He saved your life. You would have died if it wasn't for him." Mrs. Wilson's face remained set, her eyes hard as she pointed at the whiteboard again. The brother stepped forward, his voice tight with controlled emotion. "Mom, stop this, right now." Dr. Richardson held up a hand gently. "It's all right," he said, though it wasn't. "Mrs. Wilson, I am the attending physician who treated you last night, and I'll continue to oversee your care because I'm the most familiar with your case. However, you'll be seeing several members of our medical team during your recovery. Right now, what's most important is making sure you heal properly." He continued checking her vitals with practiced efficiency, narrating what he was doing in a calm, professional voice. "Your blood pressure is good, oxygen levels are strong, and the surgical site is healing well. The nurses will help you with pain management, and I'll be back to check on you this afternoon." As he turned to leave, he heard the daughter's muffled sobs and the brother's stern whisper, "How could you do this? After everything he did for you?" In the hallway, Dr. Richardson paused at the nurse's station, taking a moment to update the patient's chart. Nurse Chen approached quietly, having witnessed the scene. "Are you okay, doctor?" she asked softly. He nodded, managing a small smile. "It's not the first time, Chen. Won't be the last." He continued writing in the chart, his handwriting as steady as ever. "Make sure she gets her next round of anti-inflammatory meds on schedule. And let's schedule a respiratory therapy consultation for tomorrow." As he walked away, his white coat crisp and professional despite the weight it carried, Dr. Richardson reminded himself why he became a doctor in the first place. It wasn't about gratitude or acceptance, it was about saving lives, about doing what was right, regardless of how people might see him. He had other patients to check on, other lives to care for. But somewhere in the back of his mind, he wondered if this case might be different, if sometimes, just sometimes, saving a life could change more than just the person who was saved. The hospital cafeteria was nearly empty when the daughter finally came down for coffee. Her hands trembled as she tried to put sugar in her cup, spilling some on the counter. It had been 3 hours since her mother's awful behavior, and she felt hollowed out, like someone had scooped away her insides. Her brother found her there, staring blankly at the coffee she hadn't touched. He pulled up a chair, the metal legs scraping against the floor. "I talked to the hospital administrator," he said quietly. "They're standing behind Dr. Richardson. He's staying on as Mom's doctor whether she likes it or not." "Good," she whispered, her voice rough from crying. "I couldn't bear it if he had to step down because of her." She couldn't finish the sentence. Meanwhile, Dr. Richardson sat in his office, reviewing patient files but finding it hard to focus. A gentle knock on his door made him look up. It was Dr. Kumar, the hospital's chief of medicine, a kind-faced woman in her 60s who had mentored him during his residency. "I heard about what happened this morning," she said, settling into the chair across from him. "Do you want to talk about it?" Dr. Richardson leaned back, exhaustion evident in his shoulders. "What's there to talk about? It's nothing new." "That doesn't make it right," Dr. Kumar said firmly. "We can assign another doctor if you want. No one would blame you." "No," he said, straightening up. "That's exactly what she wants. And what message would that send to our younger doctors? To our medical students of color? That they should back down when faced with prejudice." Back in the patient's room, the brother stood by the window, watching rain streak down the glass. His mother had been writing furiously on her whiteboard all morning, demanding different doctors, threatening to leave. The nurses handled it professionally, but he could see the hurt in their eyes. "You know what this reminds me of?" he said suddenly, turning to face his mother. "That time when I was 10, and I invited my friend from school over for my birthday party. Remember that, Mom? Remember how you made up an excuse about why he couldn't come, just because his skin was different?" Mrs. Wilson looked away, but her son wasn't finished. "I was just a kid, but I knew. I knew why you did it. And I spent 20 years being ashamed of that moment, of not standing up to you then. But I'm not that scared little boy anymore." The daughter returned just in time to hear her brother's words. She moved to stand beside him, finding strength in his presence. "Do you remember," she added softly, "when I started dating Robert in college? A perfectly wonderful man who you refused to meet because he was mixed race. I broke up with him because I couldn't handle the family drama. I've regretted it ever since." Mrs. Wilson's face flushed red. She scribbled on her board, "You don't understand." "No, Mom, you don't understand," the daughter said, her voice growing stronger. "Dr. Richardson spent almost an hour last night saving your life. When your throat closed up, when you couldn't breathe, do you know what he did? He performed an emergency procedure that most doctors would have hesitated to do. He didn't hesitate. He didn't care about anything except saving your life." The brother picked up the medical chart hanging at the foot of the bed. "Look at this, Mom. Look at all the notes he wrote, all the careful instructions, all the medications he ordered. Look at how many times he checked on you during the night. This is what caring looks like. This is what a real doctor does." A knock at the door interrupted them. It was Nurse Chen coming to check vitals. She worked quietly, professionally, though everyone could see the tension in her movements. As she adjusted the IV, Mrs. Wilson's hand shot out and grabbed her wrist. The nurse froze, but Mrs. Wilson was pointing at her whiteboard. She had written, "How long has Dr. Richardson worked here?" 10 years, Nurse Chen answered carefully. "He's one of our best emergency physicians. Doctors from other hospitals often consult with him on difficult cases." Mrs. Wilson's hand dropped, and she turned to stare out the window. The rain had stopped, leaving everything looking cleaner, fresher. Her children watched her face, trying to read what was happening behind her eyes. Down the hall, Dr. Richardson was making his afternoon rounds. He paused outside Mrs. Wilson's room, taking a deep breath. Despite everything, he had a job to do. He had taken an oath to care for all patients, regardless of their attitudes toward him. It wasn't always easy, but it was always necessary. As he entered the room, he carried with him not just his medical expertise, but also the quiet dignity that had become his shield against prejudice. He didn't know if his patient would ever change her views, but he knew that every interaction was an opportunity, not just to heal bodies, but maybe, just maybe, to heal something deeper too. Later that evening, after the hospital corridors had grown quiet, the daughter sat alone with her mother. The tracheostomy tube had been removed earlier that day, replaced with a simple oxygen mask. Mrs. Wilson could speak now, though her voice was hoarse and weak. "Why are you looking at me like that?" Mrs. Wilson asked, noticing her daughter's intense stare. "I'm trying to understand," the daughter replied softly. "I'm trying to understand how the same woman who taught me to be kind to everyone could be so cruel to someone who saved her life." Mrs. Wilson fingered the edge of her blanket, a habit she'd had since her own childhood. "You don't know what it was like growing up where I did," she said finally. "Then tell me, Mom. Help me understand." The story came out slowly, piece by piece, like pulling threads from an old tapestry. Mrs. Wilson grew up in a tiny town where everyone looked the same, thought the same, lived the same. Her grandfather had been a factory worker who lost his job when the plant started hiring more diverse workers. He blamed others for his misfortune, and that blame seeped into everything like a poison. "But that was your grandfather's story," the daughter said, "not yours." "There's more," Mrs. Wilson whispered, and for the first time, her voice held something like shame. She spoke about her first job as a young bank teller, about the robbery that left her terrified, about how she let that one terrible experience color her view of an entire group of people. "I know it's wrong," she admitted, her voice cracking. "I know it in my head. But fear gets into your heart, and it's so hard to dig it out." Down the hall, Dr. Richardson was speaking with a young patient in the next room. Through the open door, Mrs. Wilson could hear his warm laugh, could hear him explaining something medical in simple, caring terms. Her daughter noticed her listening. "He was here 3 times last night," she said, "checking on you, adjusting your medications, making sure you were comfortable. He didn't have to do that. He could have passed your case to another doctor. But he didn't." Mrs. Wilson closed her eyes. "When I was your age," she said slowly, "there was this woman in our church, Mrs. Green. She was the kindest soul you'd ever meet. She got sick, cancer, and the only specialist who could help her was a doctor of Asian descent. She refused to see him, said she'd rather—" She stopped, swallowing hard. "She died 6 months later." "And you never questioned that?" her daughter asked incredulously. "I did. We all did. But questioning isn't the same as changing." Mrs. Wilson opened her eyes, looking at the ceiling. "Your brother told me something earlier. He said that courage isn't about not being afraid. It's about doing the right thing even when you are afraid." Just then, they heard footsteps approaching. Dr. Richardson appeared in the doorway, tablet in hand, ready for his evening rounds. Mrs. Wilson tensed automatically, but something was different this time. She watched as he checked her vitals, explained her progress, adjusted her oxygen flow. "Your recovery is progressing well," he said professionally. "Tomorrow we'll start you on a soft diet, see how your throat handles it." As he turned to leave, Mrs. Wilson spoke up. "Doctor." Her voice was barely above a whisper. "How many times did you check on me last night?" He paused, turning back. 3 times. Standard protocol for post-emergency procedures. My daughter says other doctors wouldn't have done that. Other doctors might have different approaches, he replied carefully. I prefer to be thorough. There was a moment of silence, heavy with unspoken words. Then Mrs. Wilson said something that made her daughter's breath catch. "Thank you," she whispered, "for being thorough." It wasn't much, just 2 small words, spoken softly. But in that sterile hospital room, they felt like the first drops of rain after a long drought. Dr. Richardson nodded once, professionally, and left the room. The daughter reached for her mother's hand, squeezing it gently. Outside the window, the city lights twinkled in the gathering dusk. Change, she realized, didn't always come like a lightning bolt. Sometimes it came in whispers, in small moments of truth, in the quiet recognition of our own humanity reflected in others. "Tell me more about growing up," she said softly. "Tell me everything. I want to understand so we can both do better." And as the night settled over the hospital, mother and daughter began to bridge a gap that had seemed uncrossable just days before. It wasn't perfect, and it wasn't complete, but it was a start. Sometimes that's all healing needs, a place to begin. The next morning brought unexpected visitors to Mrs. Wilson's hospital room. A young boy, no more than 12, poked his head around the doorframe, followed by his mother. They had gotten the wrong room number while looking for his grandfather. "I'm so sorry to disturb you," the boy's mother said, starting to back away. but the boy's eyes had already fixed on something. "Mom, look," he exclaimed. "She has the same thing Dr. Richardson gave me." He pointed to Mrs. Wilson's neck, where the bandage covered her healing tracheostomy site. Mrs. Wilson's daughter, who had been reading a magazine, looked up with interest. The boy's mother seemed uncertain, but her son was already stepping into the room, his excitement obvious. "Did you stop breathing too?" he asked Mrs. Wilson. "That's what happened to me last year. I was playing baseball and a bee stung me, and suddenly I couldn't breathe at all." His mother put a hand on his shoulder. "Sweetie, we shouldn't bother." "No," Mrs. Wilson said suddenly, her voice still rough but stronger than before. "It's okay." Something about the boy's open face, his complete lack of judgment, made her want to listen. The boy moved closer to her bed. "Dr. Richardson did this cool emergency surgery right there on the baseball field," he continued. "Everyone was super scared, but he was so calm. He had his doctor bag in his car because he was watching his nephew play in the same league. Mom says I would have died if he wasn't there." Mrs. Wilson glanced at the boy's mother, who nodded confirmation. "He was off duty," she explained. "He could have waited for the ambulance. Most doctors would have. But he said later that in those situations, minutes matter more than paperwork." The boy rolled his eyes good-naturedly. "Mom tells this story to everyone. She even wrote a letter to the hospital about it. Did you know Dr. Richardson volunteers at the Youth Sports League now? He teaches all the coaches about allergic reactions and stuff." As the boy chattered on, Mrs. Wilson found herself listening intently. She'd learned how Dr. Richardson had visited the boy in the hospital every day during his recovery, how he'd brought medical books to explain what had happened in terms a child could understand, how he'd made sure the entire baseball league now kept emergency allergy kits on hand. "Show her your necklace," his mother encouraged. The boy pulled out a medical alert necklace from under his shirt. "Dr. Richardson helped us pick it out. He said it was better than a bracelet for baseball players." After they left to find the grandfather's actual room, Mrs. Wilson sat in silence for a long time. Her daughter watched her, seeing the wheels turning behind her eyes. Later that afternoon, during Dr. Richardson's rounds, something had shifted. When he entered the room, Mrs. Wilson looked at him directly for the first time since she'd woken up. "The boy," she said, "the one with the baseball story. He said you carry emergency supplies in your car." Dr. Richardson nodded, checking her IV line. "It's come in handy more than once. Even when you're off duty." "A doctor is never really off duty," he replied simply. "Just like a parent is never off duty. Some responsibilities don't clock out." Mrs. Wilson's hands twisted in her blanket. "My father," she said suddenly, "he used to say doctors only cared about money, that they didn't really help people anymore." She paused, then added quietly, "He was wrong about a lot of things." Dr. Richardson stayed professional, but his movements became less guarded. He explained her improving condition, discussed her treatment plan, answered her questions. For the first time, it felt like a real doctor-patient conversation. As he turned to leave, Mrs. Wilson spoke again. "Doctor, about how I acted when I woke up." He held up a hand. "Mrs. Wilson, you don't." "No," she interrupted. "I do. I need to say this." She took a shaky breath. "I've spent my whole life being afraid of differences. It's a heavy way to live. And it almost cost me my life because I almost let that fear." She couldn't finish. "Mrs. Wilson," Dr. Richardson said gently, "in emergency medicine, we have a saying. The best time to plant a tree was 20 years ago. The second best time is now." She looked at him questioningly. "It means," he continued, "that it's never too late to start doing better, to start seeing things differently, to start healing, and I don't just mean physically." From her chair, the daughter watched this exchange with tears in her eyes. She saw something she'd never thought possible, her mother nodding, really listening, really hearing. As Dr. Richardson finished his examination and headed for the door, Mrs. Wilson called out one more time, Will you tell me more about that baseball league? About the emergency training you do?" He turned back, and for the first time, a small smile crossed his face. "I'd be happy to. Tomorrow during rounds." "Tomorrow," she agreed, and it sounded like more than just a simple appointment. It sounded like a promise to try, to learn, to change. After he left, the daughter moved to sit on her mother's bed. "You know what this reminds me of?" she said softly. when I was little and afraid of thunderstorms. You told me that sometimes the things we fear the most are the things we just don't understand yet." Mrs. Wilson reached for her daughter's hand. "Maybe it's time I started understanding more things," she whispered, and outside her window, the sun broke through the clouds, painting the room in warm, healing light. 1 week had passed since that terrifying night in the emergency room. The morning sun streamed through the hospital window as Mrs. Wilson packed her belongings, preparing for discharge. Her throat was healing well, though a small scar would always remain, a permanent reminder of the night that changed more than just her physical health. Her daughter folded the get well cards from family and friends, tucking them into a bag. The room had accumulated the usual clutter of a week-long hospital stay: half-empty water bottles, magazines, the whiteboard she'd used when she couldn't speak. Each item held a memory of the past week's journey. "Ready for the final check?" Nurse Chen asked, entering with the discharge paperwork. She moved with the same professional efficiency she'd shown all week, but now there was a warmth in her interactions with Mrs. Wilson that hadn't been there before. "Almost," Mrs. Wilson replied, her voice stronger now. "Is Dr. Richardson?" "He'll be here shortly," Nurse Chen assured her. "He always does final rounds personally." While they waited, Mrs. Wilson's son arrived with her favorite sweater from home. The siblings exchanged knowing looks. They'd seen their mother change over the past week in ways they'd never thought possible. It wasn't a complete transformation. Decades of ingrained prejudice don't disappear in 7 days. But they'd witnessed something remarkable: the beginning of understanding. A knock at the door announced Dr. Richardson's arrival. He entered carrying a folder of discharge instructions and prescriptions, but also something else, a small paper bag. "Good morning," he greeted everyone. "Ready to head home?" Mrs. Wilson nodded, then gestured to her children. "Could I have a moment alone with Dr. Richardson?" After they left, she took a deep breath. "Before I leave, there's something I need to say." She straightened in her chair, meeting his eyes directly. "I've been awful to you. When I woke up that first day, the things I said, the way I acted." "Mrs. Wilson," he started, but she held up her hand. "Please, let me finish. I've spent this week watching you. Not just with me, but with everyone. I've seen how you treat every patient with the same care, regardless of who they are. I've heard the nurses talk about how you stay late to check on critical cases. I've learned about your work with the Youth Sports League." She paused, collecting her thoughts. "I won't pretend that all my prejudices are gone. They run deep, and I'm still learning. But you've taught me something important, not through lectures or blame, but through your actions. You showed me what real character looks like." Dr. Richardson listened quietly, his expression professional but gentle. When she finished, he pulled up a chair and sat down. "Mrs. Wilson, in emergency medicine, we don't have the luxury of choosing our patients, and that's actually a beautiful thing. In those critical moments, nothing matters except saving a life. It strips away everything else and reminds us of our shared humanity." He opened the paper bag and pulled out an EpiPen and a medical alert bracelet. "These are important, but they're not the most crucial thing you're leaving with today." He looked at her meaningfully. "The most important thing is understanding that change is possible. It's never too late to learn, to grow, to see things differently." Mrs. Wilson picked up the medical alert bracelet, running her fingers over the engraved information. "Will you?" She hesitated, then continued, "Will you still be my doctor? For follow-up care?" "Of course," he replied without hesitation. "We'll need to monitor your recovery, do some allergy testing, make sure nothing like this happens again." She nodded, then reached for her purse and pulled out a folded piece of paper. "I wrote something for the hospital administration. About your care. About everything." Her hands trembled slightly as she handed it to him. "I'm not good with words, but I wanted them to know." Dr. Richardson took the letter carefully. "Thank you. This means a lot." The door opened as her children returned, followed by a wheelchair, standard hospital policy for discharges. As Mrs. Wilson settled into it, she looked up at Dr. Richardson one last time. "You know," she said softly, "my grandson's Little League team needs a medical advisor. If you're interested." Dr. Richardson smiled, a real warm smile this time. "I'll think about it, but first, focus on your recovery. Follow the discharge instructions. And remember, change is like healing. It happens one day at a time." As they wheeled her toward the elevator, her daughter walking alongside, Mrs. Wilson found herself thinking about the past week. She thought about fear, about prejudice, about the weight of carrying those burdens for so long. And she thought about the freedom that comes with finally setting them down. Back at the nurse's station, Dr. Richardson opened her letter. Nurse Chen watched as he read it, saw the subtle softening of his expression. "Did we make a difference?" she asked quietly. He folded the letter carefully and slipped it into his pocket. "We did what we always do," he replied. "We provided the best care possible. Sometimes that care heals more than just the body." He picked up his next patient's chart, ready to continue his rounds. Outside, the morning sun painted the hospital corridors in shades of gold, and somewhere in the city, a family drove home, forever changed by a night when prejudice met compassion and compassion won. The scowl on Mrs. Wilson's throat would fade with time, becoming just a faint line. But the lessons of that week would remain. A reminder that sometimes the greatest healing happens in the heart, one small moment of understanding at a time.